Wake up and grab your coffee, Fargo. Good morning and thanks for joining us for Morning Coffee with Dr. Berry. I'm Ryan Arthur, weight loss expert at Wellness District Medical Weight Loss, and here with me every Wednesday is your host, Dr. Spencer Berry. We have a great show for you today. We have Wellness District's very own family nurse practitioner and obesity expert, Nichole Jackson-Lind, here to discuss intermittent fasting and some of the more popular approaches to the lifestyle, and why you missing breakfast every morning doesn't count as intermittent fasting. It just means you need better time management skills, and some of the health benefits the lifestyle offers. So, what's up, Doc?
Well, good morning, Ryan. It's good to be here again. Obviously, we've got some weather coming in to the Fargo area anyway. And at this time, obviously, during this time where COVID-19 is keeping all of us indoors, I just want to say thank you to all the folks on the front lines helping to care for patients. It's outstanding, and would ask everybody to do their part as best we can with social distancing. We're practicing that here today in our studio as we record this, because that's what's going to help us as we move through this. But it's also kind of nice to have a chance to hear some information, because again, while we're home, we're looking at things. Hopefully we're going to have a chance to learn some things about ourselves, but also about some things we can do to maybe get a little bit healthier. I know a lot of people worry about being quarantined at home, and I see a lot of memes that come through talking about gaining weight and eating and going to the refrigerator a lot during this time of being at home. And so obviously what we do here at the Wellness District in working with weight management, that's an important thing for a lot of folks to learn about. And this is a good time to do that and to start to put those things in practice, because we have an opportunity to concentrate. So I'm delighted to have Nichole with us this morning. Nichole is a family nurse practitioner here at the clinic, an obesity specialist who has worked quite extensively here over the last 4 to 5 years at this clinic with patients on a daily basis, with helping them manage weight, and not just weight but body composition, to make sure they get the appropriate amounts of nutrients, so that not only do they get rid of excess body fat, which is what drives disease processes, but also hold on to skeletal muscle, etc. And intermittent fasting, that we're going to talk about today in this series, is something that Nichole has a special interest in, and has done quite extensive reading and research on it, and also utilizes it with patients here at the clinic quite a bit, as do I. But Nichole has some very special experiences, and we're going to be asking her about those. The things that I see personally, and again, Nichole, I'll just let you know the things that I see when I look at intermittent fasting, and I again look at the research on it that we have to date, and we see the clinical progress, is that one of the biggest things intermittent fasting, let's define it to begin with, which usually generally means that patients, the most popular is to take 16 hours out of the day where somebody is not eating, not feeding. They can drink non-caloric liquids, all right? And then there's an 8-hour period, where they call that the feasting or feeding period. So again, it's up to the individual. Many times folks will feed from, say, 8 till 4, 8 in the morning till 4 in the afternoon, or noon until 8 at night. And anyway, and the other 16 continuous hours after that are spent strictly fasting. There are some different methods to do that, but that's probably the most popular. So let me just ask you, Nichole, when you're working with patients here at the clinic, can you tell me what are the most popular types of intermittent fasting that you do, and then define it as you can from your standpoint, and give us some of your clinical experience?
Sure, absolutely. Well, first off, thank you for having me on the show this morning, Dr. Berry. I have been with Wellness District and nurse practitioner with medical weight loss now for almost 7 years. Believe it or not. Yes, so it has been a long time. I've been a patient, actually, of our program at Wellness District, and then had the opportunity of a lifetime to come on board and work with our fabulous patients that we have here. About 2 years ago, in 2018, at an Obesity Medicine Association conference, I first learned about intermittent fasting. Great speaker, Dr. Jason Fung, was there. That's when he was first kind of coming out with his notoriety. I bought his book, started to read it, and then delve more into the intermittent fasting, as it was becoming a more popular trend that patients were asking about when it came to improving or adding it to their lower carb or ketogenic lifestyle. I have dabbled around with it myself. I absolutely love it. I notice in those periods of time when I'm participating in intermittent fasting that I have the most mental clarity. I feel the best. My appetite is at its best control. And so it really can be an effective tool. You're right. The most common way for folks to start with intermittent fasting is a 16 and 8 fast. And typically, I know when I perform it, I do the stopping eating at 8 p.m. at night and would fast until noon the next morning. But you can schedule your time frame, whatever works with your lifestyle. Other popular methods of fasting include a day on, day off of eating, where they will fast for 24 hours. They'll stop eating at supper one night, and then they don't eat again until supper again the next day. Intermittent fasting is defined as a pattern of eating versus a diet, because it is probably one of the first programs or patterns of eating that doesn't necessarily require you to focus on food specifically that you're eating. I actually disagree with that, quite honestly, especially when people are insulin resistant. I feel that you have to have some attention to what you are eating. Because again, when you read through the literature, and even in Dr. Fung's book, that was one of the things that was most confounding to me, is that he didn't specify a certain amount of calories, a certain amount of carbohydrates, a certain amount of protein. It was fast for 16 hours and then eat a normal diet. Well, I think you and I both know what a normal diet tends to look like. And that's probably one of the biggest problems that people experience with intermittent fasting, is that they fast, they skip breakfast essentially because they don't want to eat breakfast, which you certainly don't have to. Breakfast, from what I'm finding, isn't an important meal like what we once thought. But the problem is they fast for 16 hours and then they're like, okay, now I'm really super hungry. And instead of aiming for lower carb foods and higher proteins and more fats, they actually gravitate to the excuse of, now I get to eat 3 slices of pizza and load up with a 24-ounce bottle of Coke. Well, I'm sorry, that's not going to cut it when it comes to losing weight. And a lot of the literature makes more emphasis on the fact that the reason why this works is because of a caloric deficit. It's not about a calorie deficit. Yes, that is a factor. But I believe it's more about the insulin factor, the hormonal factor that impacts and makes folks more successful when following an intermittent fasting way of eating.
I'm glad you touched on that. Excuse me, I'm glad you touched on that, Nichole. That is absolutely the camp that I'm in when I look at this. One of the frustrating things for me as somebody now who's worked with patients to help them manage weight and body composition, for disease prevention and wellness, is this idea of, quote, normal diet. And again, this is what hasn't worked for years, telling people to, quote, eat a normal diet, just be healthy, burn more than you consume.
Eat clean foods.
Eat clean. There's a lot of definitions that don't mean anything.
Right.
They don't give guidelines, don't give anybody any metrics to use. And so it's hard to get, and there are not really any good controlled studies on. And then when you look at intermittent fasting, as you said, if you look at it in its strictest forms, they'll say it's the fast, okay, for whether that's 8 hours, 12 hours, 16 a day, whatever, where you're drinking non-caloric liquids, and then you eat during a feast period. But they don't talk about specific foods, as you mentioned. And so what I have found, because I totally agree with this, is that for this to be a benefit, and I think there really are for certain. Again, like anything, it's got to work for you.
Right.
But the benefits that it has, as I see it, is that number one, it's a simpler. You can make changing your feeding behaviors simpler.
Right.
In life, the simpler we make things, the easier they tend to be to do. So when folks say, I'm going to fast for a 16-hour period, and I'll have a feeding or eating period for 8. So if they choose, as you mentioned, noon until 8 p.m., for instance, you mentioned breakfast. Now, we think of breakfast as a morning thing. What breakfast is when you break your fast. That's the name breakfast, break fast. And so break fast can be at noon. And so from the standpoint of breakfast being important, I think that first meal that we eat when we're breaking our fast is very critical, because regardless of what time of day it is, if we've come off a 16-hour fast period, our insulin levels are going to be at the lowest that our body's insulin can be.
Right.
For us, like you said, some folks with insulin resistance have higher levels of insulin. Some who are more insulin sensitive will have lower levels. Either way, we know that the number one factor in our body's decision as to what fuel it's going to burn is your insulin levels.
Right.
When insulin is high, the body tends to burn more sugar. When the insulin is low, we burn fat. Those are the two fuels the human body can burn, sugar or fat. And so after a fast of 16 hours, we're going to have the lowest insulin that our body is going to be able to have. And then if we break that fast, as you mentioned, then if we help use the proper foods, that being some protein and fat at that time, and keep our sugars to a minimum, because it's sugar, carbohydrate that is, which raises blood sugar, which raises insulin, which then defeats that purpose. So we start out with proteins and fats with that first meal, which fires up the metabolic system, and we're burning a higher predominance. We get that fat furnace going in the body. So I totally agree with the fact that, and again, in the studies I've tried to find, generally all they talk about is you fast for a period of time and you eat, and they don't really specify. And I think it's really important, that specification, as you pointed out, and help directing patients so they learn what to eat during that 8-hour period. Because what I find, like I said, it's simpler. If I take, for a lot of folks that like this method, if I'm not eating from 8 p.m. until noon, say, the next morning, I know that during that period, if I want, I can drink water or black coffee.
Right.
Okay, I can have water or black coffee, a non-caloric beverage. And some folks will say that black coffee may have some hunger or some appetite satiation decrease hunger for some folks. But the bottom line is there's no decision to make there. It's I can have water. I can have water, black coffee, and it just takes away. Well, can I? Should I? No, water or coffee. And then during that feast period, that just means there's only 8 hours that I need to plan for. Only 8 hours that I need, and that tends to make things. When you shorten that up, instead of saying, what do I do over a 24-hour period, through day, through night, through noon? No, this shortens it up and helps me decide so I can, when I get my meals and what I get, it's for that period of time. And so, again, think it's critical that we help direct people as to what to eat during those periods, just as you mentioned. So tell me a little bit, when you're having folks, you mentioned the mental clarity that goes with it, that you find. When you're helping patients, what are the most popular types that your patients enjoy utilizing, and what are the meals that you'll have them break their fast with? Sure.
Typically, the mental clarity, I believe, is part of the detoxing process, which is one of the evidence-based found benefits to intermittent fasting. There's at least 10 or more benefits to intermittent fasting when it comes to improvement of how your body functions. But one of them actually is an increase in the chemical that your brain produces that improves function and can actually increase the amount of new nerve cell growth overall. It reduces the oxidative stress and the inflammation because the blood sugar is down overall, and so you're able to think better. I sleep so much better. I don't feel like eating. Food doesn't dominate life like it can at other times when we're eating diets higher in carbohydrates. Most of the folks that, when following low carb or the intermittent fasting within our clinic, they start out with a 16 and 8 fast, which I think that's probably the most popular. It's the easiest way to branch into intermittent fasting. And you don't necessarily have to start with a 16-hour fast. There's a lot of benefit to even eating what I call the 1950s way, where you get up, you have your breakfast at 8 a.m., you eat throughout the day, but you're done eating by 8 p.m. But you're always giving yourself that 8 a.m. to 8 p.m. fasting period, which helps to lower our insulin level, which resets our circadian rhythm for insulin, and so our body functions in a more normal capacity. And then as you add more hours of time onto the fasting period, better and better it's supposed to be. And quite honestly, I do find, I always thought to myself before learning about intermittent fasting of how can people forget to eat? But after about 2 to 3 days of the fasting period, yeah, all of a sudden I was finding I was doing 21, 22, 23 hours of fasting, and that simplicity factor kicks in of, oh, I haven't eaten all day. Sure, I'll eat. I'm not really hungry, but I'll eat something. And you forget about eating. You don't have to meal prep, which I think is a big common complaint of patients or people of having to plan their meals out on a regular basis. But you do have to be careful that you don't get yourself too hungry. I was just recently at a low-carb keto conference in Denver, and they talked about intermittent fasting, and I did finally get up and ask the expert that day, Dr. Berg, that day, what do you specifically recommend to your patients when it comes to macronutrients, and pointed out the fact that a normal diet isn't going to be beneficial to people. And he, of course, agreed with that. And he's like, well, nutrient-dense foods are what we should be aiming for. Well, again, people can have different definitions of what are nutrient-dense foods. And so I'm like, well, can you give me more specifics? I work with a population of people that require specific information. And he's like, well, proteins, saturated fats, and very minimal green leafy vegetables. And I'm like, well, then why don't you say that in the research or in the documentation that is produced instead of just a normal diet? And the panel of experts agreed with that, in the fact of, you're right, everybody's definition of nutrient-dense food is going to be different across the board. And so what he recommended, that if people are still experiencing hunger, extreme hunger after a fasting period where they then kind of lose control of what they're wanting to eat, then he's like, you have to pull the carbs down more. So if a lot of times when people are wanting to start, I will start them at 50 grams of net carb. And if they tell me that by 2-3 in the afternoon they are ravenous and they don't care what they need to eat, they just need to eat, then that tells me overall they're still eating too many carbs during that feed window. And then it's recommended that you pull it back from there. Go to 40. If their hunger doesn't improve, go to 30. A real popular way of following intermittent fasting is incorporating it with a ketogenic diet, where you only eat 20 grams of net carb a day. And you definitely, and that's honestly what I do. I try to stay between 20, 25, and 30 grams of carbs when I perform it. Feel the best in that capacity.
Yeah, it's interesting because one of the things about the feeding and fasting that goes on, folks say, fine, fasting, I get fluids. I can have all the water I want, black coffee, etc. Now, when it's feeding, what should I be feeding on? And you mentioned hunger, because hunger, when you say what is the number one thing that patients will experience with intermittent fasting, if you will, a side effect, or it's hunger. They'll talk about hunger. And it's my belief, and I've seen it clinically in my practice, is that it's because they're getting too many, as you just pointed out, too many sugars, too many carbohydrates during the feed period. Right. Because what we know about humans is that the more sugar we eat, the more carbs we eat, the more we want. The less we eat, the less we want. And so this, when patients understand this, when they're told this and they know this, and then they practice it, and they find out that, wow, when I'm getting, proteins and fats, if I'm eating a cheeseburger patty or I'm having a pork chop with some, again, broccoli and cheese, so when I'm getting proteins, fats, and vegetables, I stay satiated, I stay full, I don't get hungry. The problem with sugars, and especially the way in our culture, many times we start them out in the morning with people eat rolls or donuts, or we have cereal with milk and orange juice. That's right. We have a lot of sugar. That leads to our blood sugar going up. That leads to the insulin going up. The sugar comes back down very rapidly when the insulin is high, which is what they call orexigenic, meaning hunger producing, and we start chasing sugar all day long, and that's why we're hungry. Patients will say, I'm hungry all day long, and the reason they're hungry all day long, they're getting too much sugar. So during those eating periods, rather than just say, yeah, eat what you want, do what you like, I prefer giving them patients instruction on what is best for them, and then that just limits the window that they need to be considering.
Right.
And that's what I find patients. For me, I look at it and say, number one, simpler. Okay, and the simpler we keep something, the easier. And as you said, the 16 and 8 is very common. 16 of fast, 8 of eating or feeding. You can do, like you said, the alternate days. Some patients will go 24 hours on, 24 off. And patients will bounce in and out of this. Mm-hmm. They may do it for 2 weeks and then stop and go back to a different pattern. And again, that's fine. Mm-hmm. The key for patients to understand is that it's what we do consistently over time that's going to determine our health. Not just our weight, not just the number on the scale, but our health, meaning enough skeletal muscle mass, decreased visceral fat, the fat that lives in the abdomen and drives disease. Mm-hmm. Okay, and so if I keep something simpler, it's easier to do, makes it more predictable. Because I know, hey, this is my feed time. And like you said, that's why the 16 and 8 is so common, because then patients know, regardless of where they're at, whether they're at home or at work or traveling, East Coast, West Coast, doesn't matter.
They can plan it around there.
That's right. They can plan it around there, and they know that this is when I eat and this is when I fast. And so it makes it predictable. That decrease in insulin level, I believe, at this point is the biggest role it plays, because when you decrease insulin to the lowest the body can have it, that causes us to access our body fat much more readily than when our insulin levels are high. And because weight loss is probably one of the most common reasons people start to dabble with or get into intermittent fasting, they want to know, is there increased weight loss when I do this versus another method? Well, some studies have said that and shown that this hormone change we talked about can maybe slightly increase your resting metabolic rate a little bit. Temporarily, that's right. And then if, in fact, by managing those 8 hours, and if you manage them well, by getting, again, adequate protein and fat, keep the carbs down, then you tend to burn more fat. So if I'm elevate my resting metabolic rate, and then if I put activity in there and keep the proportions of what I'm eating correct, I can lose weight. However, if you don't watch what you do, as you pointed out earlier, if you're not watching what you do during that time when you're feasting, if you will, or feeding, it isn't going to help you with weight loss or health in general.
Right. And weight loss can be really slow with it. I know that is one of my frustrations with it, because I'm human just like everybody else. You know, I feel like, well, I haven't eaten really much for the last 3 days, but the scale isn't moving. Now, am I at a closer normal weight for my height and whatnot? Am I a leaner composition? I am. And so I'm going to shape shift more than somebody who maybe has more body fat to lose. But I have to remind myself I have to stick with it. Because it really does take time to see bigger drops on the scale. But I think that also speaks to somebody's level of insulin resistance. I think it speaks to the amount of weight they have to lose and the body fat they have to burn. I've read a couple of articles that in order to see bigger weight loss, that you even probably aren't going to see major results for even 3 weeks. So this is a slower time or a slower amount of weight loss. One of our patients that was particularly successful with intermittent fasting did get herself, she was a traveling salesperson, and so it worked well for her lifestyle. It made it simple because she didn't have to pack meals, she didn't have to stop at fast food restaurants. She would just go about her route, and then at home, when she got home at night, she would make herself one meal, which usually consisted of a protein like a steak and a green veggie, and she'd put some butter on that veggie and she'd go to bed. Her weight loss pattern was interesting because she would go 1 month where she absolutely lost almost nothing. And then the next month she would come in and she'd be down like 5, 6, 7 pounds. And so it took her about a year to get to her goal weight. I was curious and kind of used her as a science project. to her not knowledge, but followed her body comps. I would have her do a body comp every other appointment, just for the fact that I was curious in, is she going to strip muscle eating in this capacity? She did not. She actually maintained every single ounce of the muscle mass that she had on her body and added some, which with human growth hormone, when you are eating less overall and you are in that fasted state, you produce more human growth factor or human growth hormone. But insulin is a dominant hormone, and so if you overeat your carbs, you're going to instantly spike that insulin factor, which as soon as that insulin shoots up, human growth hormone goes down, and that's actually when you do truly move into a starvation period, versus that's where you're going to strip muscle and add fat, versus the opposite of what you're wanting to achieve. So yet again, an important thing in the fact that you have to keep the carbs down. This isn't a mealtime situation where, well, I just eat now whatever I want. And I think it speaks back to where we're coming from of you kind of have to set yourself some goals and guidelines in order to be successful, to see the weight loss, but also experience the other health benefits that come along with it.
The adequate protein is what you're describing when you're talking about this patient having a steak or some form of protein. The body needs enough protein, and again, for ladies in general, 90 grams a day of protein is enough to add to their what they call amino acid pool. We have amino acids make up protein, so if you get 90 grams of protein, we're going to add to that amino acid pool because we're constantly turning over proteins in our body every day. Muscle is turned over every day. A lot of the hormones that are protein-based and or some of the transmitters on the cell membranes and intercellular communicators are proteins. Anyway, we're constantly making them and destroying them, so we've got to bring in. We will recycle and reuse a lot from our own body, but we have to bring some in from the outside. And if we do not maintain adequate protein, we can tend to lose and shed muscle mass. And this is something, Nichole, that I think we've been on board with here at the clinic and are at an earlier phase than a lot of places. We've been watching body compositions now for, again, the whole of the time that we've been here now, approaching 9 years. And by watching this and realizing that health, as it relates to weight management, isn't just about the number on the scale at all. No. It has to do with the composition of the body. What is our lean mass? Bone and muscle, being the two lean masses. Bone doesn't change a lot month to month. Muscle mass can. All right, and then of course fat mass. We're trying to shed fat mass, and as we like to say, no patient comes into the clinic to say, "Hey, Dr. Berry, I am too strong. Can you help me get rid of some muscle?" Okay, when it's weight loss, we want to get rid of body fat. It's understood. And specifically, we're talking the visceral body fat, that 20% of our total overall fat that lives in the abdominal cavity. Right. It's a very different fat than the other 80% that lives under the skin in our arms and back and buttocks. That visceral fat is what produces a lot of those, what they call inflammatory cytokines and things that will drive insulin resistance, diabetes, heart disease, cancer risk. So, and the good news is that as we moderate our dietary intake to get adequate protein and restrict the sugars, restrict them, not eliminate, restrict, we can get rid of visceral body fat. And so the combining of the intermittent fasting, as you mentioned, with its benefits of lowering insulin, growth hormone increasing, again, some of the studies, there's a lot of studies with animals and mammals even, not a lot at this point on humans. That, I mean, what's out there is very small in nature in terms of numbers, short in duration. So we're still working on that, and that research is being done, and that's great that it is. And again, I'd like to see it done with the intermittent fasting combined with the lifestyle, with the lower carbohydrate and the lower sugar intake, like we're talking about. Because I think when we put the two together, we can see for that right individual who that's a good lifestyle pattern for them, we see tremendous results with them. And so, because that's the goal, we trim visceral body fat, and that's where we trim disease. Because most folks, they want better health, okay? Right. Physical, mental, emotional, and psychological health. And as patients learn how to eat well, and that's the way I describe it, learning to eat well, because eating is a skill. And again, we haven't thought about it that way. Well, intermittent fasting is a tool that can be used to help patients learn to eat well, because if I narrow down the time that I'm eating to, say, an 8-hour window, and I'm fasting, which I know that I can drink fluids,
Mm-hmm.
non-caloric fluids during that time, and I would stick to water. Any other fluids you allow? Water?
Water, black coffee, and I even go as far as specifying to them that no artificial sweeteners in their coffee.
So they stay away from the Diet Cokes and Diet sodas.
Dr. Fung does allow bone broth. He's a believer in bone broth in his fasting window. Because of course there's known benefits to bone broth, and it is supposed to be relatively no carbs and sugar because of course it's derived by bone. He recommends bone broth, black coffee. I will even allow green tea as long as it is unsweetened. You're not adding any artificial flavor or sweetener to it.
The key is to stay very well hydrated.
Right.
That's the important thing. Sometimes when people hear the word fast,
Mm-hmm.
they don't drink. And so
Right.
we have that issue with patients coming to the clinic to have
For their
blood
lab
drawn.
work.
Somebody says you need to fast after 10 p.m. and come in and have your labs drawn. Well, they don't drink anything either. Well, the body dehydrates, and that can mess up your kidney numbers
Right.
and some other tests. So very important. Fasting means from food, okay, and caloric liquids. Water and black coffee, things that don't have calories, things that will keep you hydrated.
Mm-hmm.
That's what we want. And so staying hydrated during this is important. And then I think hopefully the audience has picked up on the fact that both Nichole and I feel that what you eat during that, what they call feasting or feeding window, is very important. And if this is a lifestyle that you feel benefits you, this is a wonderful way to do that, to simplify and say, okay, there's 8 hours to think about rather than 24,
Mm-hmm.
or there's maybe if you want to do 10 and 14, it's whatever you works in your life. But if by making that window smaller, if that helps you put together the appropriate, and that's what we help patients do then, is arrange what to have when they break that fast. Again, that's what breakfast is. The term breakfast, which we've all used for years, it just means breaking fast, right? You get up in the morning and you have breakfast. You're breaking the overnight fast. But you can break that fast at noon, and you can break it at any time. And what you have for that first meal, which then we call breakfast,
Right. Proteins and fats. Mm-hmm.
is really critical. And so some of the other health benefits that have been talked about possibly with intermittent fasting, again, a lot of these come from animal studies, specifically in mammals, not so many in humans at this point. You hear about decreased risk for cancer. This has been shown again in some short-term animal models, but not in humans as of yet. Research, obviously, more of it being done and is ongoing. One of the biggest things is cellular repair. The idea of cellular repair and longevity. Can we increase our lifespan with this? We know, again, in laboratory animals, they have, with intermittent fasting, shown they can increase the lifespan of certain mammals, and also, and that's based on what, as you mentioned, oxidative stress and the aging process. Now, a lot of that is yet to be determined in humans,
Right.
and not everything, and that's why we always have to be careful. Things don't always translate from animals to humans. The great spike that we see in human growth hormone in some of the mammals, in the lower mammals, we don't see quite as much of in humans. But again, they're looking into it because this is we're trying to find and separate what are the benefits, what really can we count on from this?
Right.
Because again, if we follow the science, that's always the important thing. And so I always like to say we want to expose everything to scrutiny. Scrutiny just means you test the hypothesis, the theorem, and you decide is this correct or is it incorrect? And that's the scientific method. And so intermittent fasting has shown some benefits. And again, for me at this point, I guess I would sum up from my standpoint is for those individuals that feel this fits their lifestyle, it can be simpler for them, easier to do. It can make it very predictable, as you said. They don't have to carry things with. They know exactly when they're eating, when they're not. It lowers those insulin levels. And by lowering those insulin levels, we know that the body can access fat and burn it more efficiently. And that if we help them with what to eat during that feeding period, that can make a huge difference then when they combine eating well during the feeding period with the fasting. Many patients just do beautifully, feel well. And then, like I said, as we look at, and we're currently working with patients as to, how can they train during this time? And again, you'll find, yes, you can. You can train just fine during this period. we're finding a lot of the things that we used to think about, athletic training, etc., and what we need and don't need. Those rules are very quickly changing, and so as we work with patients on this and move forward, we're going to learn obviously a lot more. Ryan, do you have any other questions or thoughts today?
Fact or fiction? You can drink liquids during the fasting period.
Correct. Yep. I think we've kind of talked about that with black coffee, water, bone broth. I have personally, during my feed window, not during my fasting window, I will throw in one diet pop. I have thrown in a diet pop. I will do a protein shake, which of course those usually like the Premier shake that we recommend, those of course are going to have the artificial sweeteners. Didn't seem to impede progress, didn't seem to increase my appetite by having those. Now again, I wasn't having 4 of them. I was having 1,
and that's during your feed window.
During my feed window, not during the
To be clear,
fasting
during the fasting,
right.
non-caloric
I think it's better
liquids.
to call it a feeding period versus a feasting period. I think feasting is a big misnomer.
Well, and I agree.
What it sounds like.
Right, because that's when people think, well, now I get to binge on whatever I want to eat because, I didn't eat anything earlier on in the day or for an X amount of period of time. I agree. I think feeding, if we're going to get particular about our words that we use, I think feed period is a much more accurate way of
I agree. I do think that nomenclature matters. Like I said, every week I talk about the fact that you have to define things, to stay away from relative terms, and I think how you speak about things matter. And I agree, feeding and fasting, because the term feast, if you ask people what feast, they think that's
they think
a lot.
Thanksgiving dinner.
It's everything
Right.
on the table and a lot, as opposed to a feeding period just means that's when I get to eat.
All right, fact or fiction? Fasting will cause muscle loss.
I say it depends. Okay,
If you're
not
doing
the
it
answer
right.
you want. If you do it right, okay. So it's a little bit of both. The key to holding on to muscle is getting adequate protein during the feeding period. So if you're getting adequate protein, which 90 grams for women, 100 to 120 grams a day for males, if you get that during your feeding, then it's not going to cause you to lose muscle mass. And holding on to skeletal muscle mass is one of the most important things we do to keep our metabolic rate up and also our quality of life, because our muscle mass is what is responsible for balance, endurance, strength, coordination, etc.
I would add to that too, in the case of the patient that I spoke about earlier. Now, clearly she was not taking in 90 grams of protein. She was having a steak or a large pork chop when she was only eating, kind of fasting in a 20-hour period and then eating in a 4-hour period. And like I said, I checked her body comp regularly because I was very, very worried that she was going to strip muscle. And she did not. She did not strip muscle. She maintained every ounce, plus even added a little bit. And from my research and what I've read in Dr. Fung's book is the protective measure when the adequate protein isn't there is that human growth hormone. That is what protects it. So when I said, well, if you do it correctly, you're not going to strip muscle. So if you don't take in your 90 grams of protein, not saying that you should do that. I do still feel that you should try to get at least 90 grams of protein, which I have no problem doing in my feed windows when I'm participating in it. But if you're not able to, it's not the end of the world as long as you don't spike insulin. Because like I said earlier, once insulin comes into play, that wipes out human growth hormone because insulin's a dominant hormone, and that's when we're going to strip muscle mass. But if you keep your carb factor down, keep that insulin factor down, human growth hormone then stays in place, and it has that protective mechanism for some of that muscle mass.
Yes, a lot of this goes back to human evolution.
Right.
Because during human evolution,
We
obviously,
didn't eat all the
before
time.
refrigerators and things, there were longer periods where it was not uncommon for humans to have to go sometimes 24, 48, 72 hours between meals or even longer.
Right.
And so at that time, that's why during those fasting periods when they were taking in, water, basically at that time for the most part, after a certain period of time, maybe at 3-4 days, like you say, the growth hormone levels will start to come up, And the growth hormone does a couple of things. It helps, as you said, it's anabolic. It'll help us hold on to muscle. It changes some of the things in terms of how the body works metabolically, so that instead of tearing down muscle, which that's one way the body has to make blood sugars, to tear down the muscle or the proteins, instead of doing so, it turns over and helps us burn fat more. And so we kind of flip the switch to burning more fat, and that gets kind of into the ketogenic that we've talked about. But again, it's that protective effect. So the bottom line is, again, work with a healthcare professional, work with somebody who understands intermittent fasting, knows what you're doing, knows if it's good based on your medical situation, and learn to do it correctly.
Fact or fiction, can you take supplements during the fasting period?
I would say yes. But a hard lesson learned about 4 weeks ago with a new patient that came in, and now this patient wasn't trying to do intermittent fasting. She was just joining the normal lower carb program. But we were going through her med list, and she brought actually in all of her supplements and bottles of medication and set them on the desk. Almost every single one of her supplements was a gummy. And I immediately started flipping them over, because what constitutes gummies? Sugar, right? And so that's what makes it taste good. And that's why people buy them, because, it's not this powdery pill that they're trying to shove down their throat. And so I looked at every single one of them. She had 5 gummy supplements, which all totaled about 20 grams of carbohydrate that she was taking in the morning time frame. She was popping a gummy in that morning time frame. So yes, can we take supplements in the morning? Sure, but you need to look at the label on the supplement. As long as there's no total carbs on there, as long as it's not coated in something powdery or sugary, as long as it's not a gummy, I would say yes, you could take supplements in the morning, but you have to look at the label on everything that you're consuming.
Yeah, when we think of supplements, again, breaking nutrition down, again, to make it simple, we have macronutrients and micronutrients. The macronutrients are those things that provide us with calories, energy, and that's proteins, fats, and carbohydrates. The micronutrients, there's 2 of them. There's vitamins and minerals, calcium, potassium, etc., vitamin A, vitamin B. So when I think of supplements, I'm thinking along the line of vitamins and minerals. And so as long as Nichole pointed out, if you're taking a multivitamin or you're taking something with some calcium, potassium, etc.,
vitamin D capsule.
Vitamin D cap, exactly. Those things are absolutely fine as long as they don't come, as she mentioned, as a gummy form. Make sure they're coming. And again, easy way to do that is to look on the bottle that you buy them in, or where on the back it'll tell you total carbs. Look at that total carb piece. If that total carb piece says 0, you're okay.
All right, last fact or fiction. Is intermittent fasting the cure for COVID-19?
Fiction. Absolute fiction. This COVID-19, it's interesting. There's a lot of good news in the last 24 and 48 hours on this as to a lot of therapeutics that are being looked at right now. And so there are multiple studies underway, and there's no question that our scientists throughout the world, but specifically here in the United States, are really cranked up and intense on this. We have multiple candidates for vaccines. We have multiple candidates for therapeutics and even prophylactics, which are being tested. We should have some early results here in the next week or 2. They're being widely distributed. You hear a lot of stuff on the TV and on the news, and so we ask people, take it with a grain of salt. Make sure you're getting it from a good source. It's very important that it comes from a good, reliable source. But right now, there is some very promising early evidence about what we can do. So let's all continue the social distancing like we're being asked. Let's follow the guidelines. Let's get this country as well as we can from that standpoint, so we can move forward and all get back to our usual life.
I would like to add to that, too, everything that Dr. Berry said, yes. Having continued to see our patients virtually from home, of course, we kind of joked about the memes at the beginning of the program here about everybody, binging and staying in their home. That is one of the things that I have been preaching, I guess, if you will, to our patients, is that this is not the time to become a professional baker. This is not the time to practice your Christmas baking skills or loading up on that junk food. Because again, sugar begets inflammation. And I think when our body is in a more inflamed state, it sets us up for more potential of contracting illness. So if you're feeling helpless in being able to help this, yes, stay home, wash your hands, listen to authorities, but keep yourself in the most healthiest state. And by doing so, keeping inflammation down. And to keep inflammation down, we need to keep our insulin level down, keeping that sugar factor down. So I don't think intermittent fasting is the cure for COVID, but I think you can improve your chances in your immune system support by keeping inflammation down. So again, keeping proteins, fats, and up and carbs to a minimum, and then you can not rest assured, because that's no guarantee, but you can feel better in the fact that you're taking care of your health during this situation.
That's a very good point, in that we know, and this is especially true, again, all ages, but especially as humans age. And by that I mean as we move 40, 50, 60, 70, and go through the years, which A, they're inevitable, and B, we all hope that happens for us. We know that one of the main things that'll help our immune system stay as strong as it can is if, in fact, we eat well. Right. And by eating well, it's just the things Nichole was talking about. Avoiding things that are going to cause inflammation and promoting the things that are going to give us better health. And so, but you have to eat well. And that's the important thing. And that's what we do here at Wellness District, is help patients learn how to put together a well-formulated nutritional intake so that A, they keep skeletal muscle mass, so that they decrease fat, and for better health. And again, we watch and monitor that closely. And so we are seeing people virtually, and so we're doing, if you will, telehealth here. And if you go to our website, you'll be able to see we're helping not only with weight management situations for patients, but also we are offering a service as it relates to medical care as well. So if you go to our website, you can check that out. And if you feel that would be something that can help you avoid a trip to an emergency room or a walk-in clinic during this time, we're certainly available to do that.
Well, that's all I have for you today, docs. Thanks again for joining us for another episode of Morning Coffee with Dr. Barry. A big thanks to our special guest, family nurse practitioner and obesity expert, Nichole Jackson-Lind, for joining us today. I know it's early, and I know you have tons of patients to see here within the next 5 minutes, so we really appreciate you taking the time to be on the show. If you have any questions, comments, concerns, or ideas you would like us to address on the show, please email us at staff@fargowellnessdistrict.com. Join the doc and I back next Wednesday morning when we take the show primal and discuss the paleo diet. Any last words, Nichole?
No, thank you very much for having me, and I look forward to chatting with you again in the future.
Any last words, Doc?
Again, everybody stay safe out there. Follow the guidelines that are being issued for these next 30 days. I know it's inconvenient, but inconvenience is a small price for us to put in to help all of those around us. So let's do it, and we'll look forward to seeing you again next week. And we also look forward to having Nichole join us again in the future. And so thank you, Nichole, for being here.